Hi, folks, it's Mark Merrill with Farm. We're going to be talking about the state of healthcare. Not a very great topic to be discussing with the family members, but it has to be addressed, folks. You see before you, of course, the new DHHS Secretary Robert F. Kennedy Jr., and we're all talking about how there's going to be a stop to recommending routine COVID vaccinations for not just children, but teens and women as well. What we're going to start off with, folks, is that Mr. Kennedy, in most recent press releases and news reports, either good or bad, some details from a report from Epoch Times, an article actually, plus a recent Maine General Medical Center Journal of Wellness and Healthcare, the spring and summer of 2025 issue, a mailer to be exact to the general public, with noted pages in this journal mailer to review also towards the real truth of healthcare, they say, hospitals, doctors, nurses, and patients about keeping their primary care providers, while some smaller community hospitals are closing, like Sebasticook Valley Hospital in Pittsfield, a small city. And not to mention one particular hospital in the central Maine area of Waterville, where my family and myself are located, is Inland Hospital through Northern Lights. It's terrible. When a hospital is closing because the state legislature and the governor won't appropriate or accept or somehow stifle Maine Care benefits so that the hospitals around the state can function, not just one or two. Well, they don't care, obviously. And they're closing, as we said, no thanks to Governor Mills or the crony Democrats with the majority in the House and Senate who value their deep pockets for self-preservation and bankrupting Maine Care and Maine health insurance options for citizens. Truth be told, folks. Now, a recent report from the Epoch Times is what we're about to give you a little excerpt from, folks, and we also have a rest of the article that we will read after this brief segment online. Now, back on May 15th, not that long ago, Epoch Times presented the update from the federal DHHS under Mr. Kennedy to stop recommending routine COVID vaccinations, as mentioned, for children, teens, and pregnant women, along with the federal CDC stating the following in this portion of that article.
The Department of Health and Human Services plans to stop recommending routine COVID-19 vaccines for children, teens, and pregnant women, a senior agency official confirmed to the Epoch Times. The development was first reported on May 15th by the Wall Street Journal. A formal announcement is expected in the upcoming days, according to the report. Currently, the Centers for Disease Control and Prevention recommend that individuals 6 months and older receive an updated COVID-19 inoculation. 3 COVID-19 vaccine shots have been authorized for use in the United States: Moderna and Pfizer/BioNTech as messenger RNA-based inoculations, and Novavax's protein-based vaccine. The Food and Drug Administration was supposed to decide on Novavax's application for approval by April 2nd, but missed the deadline, the company reported. DHHS Secretary Robert F. Kennedy Jr. previously said that Novavax's vaccine is not effective. It is currently available under emergency use authorization. The evidentiary bar for approval is higher than for the emergency use authorization. According to CDC data, around 13% of children and 14% of pregnant women had taken the updated COVID shot. Kennedy has long advocated for vaccine safety. During the COVID pandemic, Kennedy was a vocal opponent of COVID-19 vaccine mandates, and he has frequently questioned their efficacy and safety. Kennedy petitioned the FDA to revoke the emergency use authorizations of COVID vaccines in 2021. In 2023, the CDC added the COVID-19 vaccines to the vaccination schedule, following a recommendation from its vaccine advisory panel. Last month, the same panel said that it is considering narrowing the universal recommendation for COVID-19 vaccination.
And it just, folks, keeps getting worse and worse instead of better and better. Why is that? Well, we're going to give you a little bit more into that national article from the Epoch Times. Basically, from that point on, officials noted that in the same meeting that the United Kingdom and Australia are also among the countries that do not recommend COVID-19 vaccine boosters for healthy children. Healthy children, by the way. Like Kennedy, FDA Commissioner Marty Makary expressed concern about the efficacy and safety of COVID-19 shots. The FDA plans to debut a new framework for vaccine approvals in the coming weeks, according to the Wall Street Journal that the Epoch Times picked up. Separate from my role, said Makary, as a regulator of the FDA, I am not encouraging, he says, or insisting young, healthy children to get a COVID shot unless there is new evidence that emerges that suggests there is a clear benefit. Now, I just want to tell you one thing here, ladies and gentlemen, and it's quite important. Recent news has come out at the time of this podcast coming out. There's all kinds of threats being issued from the CCP and coming through the United Nations and other groups in this country who want to see this country die. A threat of COVID-19 in a more livid and deadly form, according to them, not to me. I want you to know, ladies and gentlemen, there's not a panic going on, but they're trying to create one. That it's going to be worse than the one that occurred coming through our country from the Wuhan lab to the west coast of the United States by a ship of elderly people. Killed almost 150,000 of our citizens, needlessly. And Donald Trump did not cover it up. He put a limited stay at home for a certain period of time for citizens and temporarily, folks, for school children and college students. Janet Mills didn't decide to follow along that because his name is Donald Trump. Back in April of 2020, yours truly was at a rally on Patriots Day of 2020 where a young representative named Laurel Libby, among others, including former Governor Paul LePage, was in the audience, outside the State House and the Cross Building. Janet Mills doesn't care about anyone if they don't have a D next to their name. Keep that one in mind, folks. Now, as we continue on, Mr. Makary, as we said, is the FDA commissioner, expressed his concern about the COVID-19 shots and their safety and efficiency, or efficacy, whichever you like to choose. But a new framework for vaccine approvals is coming in the next few weeks, according to the Wall Street Journal. Now, you know what? I'd rather trust this gentleman with the FDA than I would anybody from the former Biden administration, and even, of course, Dr. Fauci, who was introduced during Trump's term while he was fighting to save his life and his political career between 2016 and 2021. And once again, it bears repeating, folks, separate from his role as a regulator at the FDA, Mr. McCary stated, quote, "I am not encouraging or insisting young, healthy children to get a COVID shot unless there is new evidence that emerges and suggests there is a clear benefit." Let's discount the recent threat from the United Nations and the national CDC about a new deadly COVID virus that's spreading quickly. I don't buy it, and neither should you, folks. Check with your primary care physicians for more specific and accurate details. Enough of this. Mr. McCary noted that vaccine companies might be required to submit additional data to the FDA. Under Mr. Kennedy's guidance, the HHS has said it will require placebo testing for all new vaccines. Now, you see, that's common sense. Mr. McCary added, "We want to see vaccines that are available for high-risk individuals. And at the same time, we want some good science. We want some good clinical data." That's it from the Department of HHS, folks. It really is. And we're going to get on to another one right here that's a little bit more involved here as far as our own state is concerned. Now, what do we think is going to be happening to our hospitals besides the closing in the next few weeks of Inland Hospital here in Greater Waterville? That's a lot of people out of work, folks. Not only that, rescheduling and administering and sending doctors and nurses scurrying to find jobs. This came out recently, folks, within the last week or so, from Maine General Medical Center. It was one of the hospitals you see before you here. Thayer unit on top. The other one is the Alphonse Center, which doesn't show up all that well, so we'll bring it up just a little bit. There's the Alphonse Center down below and the Thayer unit in Waterville there. But this is what Maine General Medical Center has decided to issue to the general public. The state of health care. Not very good timing, was it? The healthcare landscape is radically changing, they write in this one article of this journal. Maine General is not immune from the financial challenges facing Northern Light. In fact, all of Maine's nonprofit hospitals are challenged right now. They include Maine Care payments delay. Gee, I wonder why. Got any answers there, Dems? Janet? The hell's the holdup? Declining reimbursement rates and denials of payment. Pharmaceutical companies are undermining the program's effectiveness, increasing cost of doing business, the rising cost of healthcare operations such as supplies, wages, and health insurance. Impending federal government changes. Now here's where it gets really stupid, folks. It is. It's stupid. Possible changes to Medicare and Medicaid by the federal government, cutting federal and state support to covered individuals and or those health systems that serve them. One man, ladies and gentlemen, does not control the entire country. He's the president, and he was duly elected by close to 80 million people back in November of 2024. Stop it! This is the undermining of the Democratic Party of this state. They're the ones causing the fear. I wouldn't be a bit surprised that there's a majority of them, ladies and gentlemen. A recent news report, you can certainly check it out, with the Epoch Times or the Wall Street Journal or some more reliable news sources, such as Newsmax and Fox News. But you see, the Maine General comes out and says, well, among actions we have taken so far. And here are 1, 2, 3, 4, 5 bullet points they point out. This is a more extended version here of our show, ladies and gentlemen, our program called The State of Healthcare. It's not looking too good, according to some people. But among the actions Maine General says it's taken so far has identified 148 total positions for reductions, and of those, 54 were unfilled and are closed. 60 employees offered redeployment, 14 had a reduction in hours, and 20 had their positions eliminated. Hey, what's the difference between closing positions that were helping the hospital operate? What's the difference? Converted the inpatient physical rehab unit to med-surgical beds. This decision necessary to help increase our inpatient capacity. Working, they say, to reorganize rehabilitation services to redeploy employees. Workplace health will have reduced services at the Thayer location. Ding, 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 ding. Ring a bell? A lot of people. Reduced services at Thayer, but will continue to offer all services in Augusta. Those go into effect June 2nd. Coming really near to that date, folks. And anticoagulation and diabetes and nutrition clinics will be operating 4 days a week instead of 5. Additionally, Maine General says they look to continue to find ways to support Greater Waterville with access to services that Inland had provided. And, quote, a representative said, we're with you. Isn't just something we say, it's something we work hard to deliver daily. Yeah, you believe that? We are committed to providing patients with high-quality patient-centered care and will do our best to help with changes. Thank you for patience during this difficult time. Now, ladies and gentlemen, we are also going to provide the link for Maine General Medical Center, who produced, and the people behind it who you can contact. Their offices are right local. For those of us who know Waterville pretty well, central, north city just north of Augusta, the state capital. But also, this publication called Health Matters is published as a service for the people of the Kennebec Valley region. Information is written by Maine General's marketing and communications staff. You know what? We're going to provide them for you. Not just the CEO of Maine General, who, by the way, is Nathan Howell. Here's somebody who's got some explaining to do. Nathan Howell, ladies and gentlemen. So that's what we've given you so far, folks. As for the hospitals that may follow the same path as Inland, once again, we would like you to see that it's Thayer that we have showing here at the very top, Thayer unit, and the Alphon Center in Augusta on the bottom. Finally, folks, it is our turn at Firm to make sure that everything comes to a particular climax or a point, shall we say. We'll make sure of that in just a moment here. as per the information provided by Mr. Kennedy and the FDA Commissioner, Mr. McCary, Robert Kennedy's leadership, from our point of view, firm. His leadership to change Make America Healthy Again poses the question, why does the DNC, the Democratic National Committee, or chairperson, just so you don't get all bent out of shape if it's a woman, why does the DNC and or the Democratic Socialist Party of America, this is another one you need to look up, folks, why do they keep filing lawsuits after lawsuits against not only President Trump, but against any law-abiding constitutional American citizens? We propose an answer, but you can certainly make up your own, folks. I'm sure most of you law-abiding Americans and Maine citizens have better ideas on how your family needs to have healthy medicine or healthy diets prescribed on a regular basis, more than the government does. What is it we say here that why does that keep happening against Mr. Trump or against the law-abiding citizens of this country, not just here in Maine, but around every other state? We feel, ladies and gentlemen, it's to destroy or control citizens who disobey their own ideologies, which are not constitutional. Let that one sink in, especially them. In the meantime, we will provide some links for Maine General Medical Center, the Marketing and Communications Department, CEO, Maine General Medical Center. But stay tuned to us as well, ladies and gentlemen, for podcasts on rumble.com/fairnessmedia1, YouTube, Twitter, and emails 24 hours a day, 7 days a week. fairnessinreportingmedia@gmail.com, fairnessinreportingmedia@gmail.com. Everybody, pray for our country, pray for our hospitals, our doctors and nurses, our families. Stay safe and peace to all.